Jamaica, then I went to Nashville, then from Nashville to
Tennessee.
New York, yes. Then from New York to Delhi, then it was very long.
Oh my
It
God,
was
from Delhi to
expensive.
Trivandrum. So you took five planes to get here, that is?
I did.
So from Jamaica to Nashville, Nashville to New York, New York to Delhi, Delhi to Trivandrum, and then this taxi ride. Oh my God, that's
It was
the
terrible.
longest.
I'm telling you, it's terrible.
What time did you reach here?
Yesterday I got here 5 p.m.
So you didn't have a good night's sleep?
I did.
Because you don't look weary, you look
don't-
fresh.
Yeah.
That's good.
I slept well.
That's nice.
Yeah, I slept well.
So that's one good thing that's happened. All right, so we just start with your consultation process. We
Do you
just
remember me?
Of course.
You do.
We
okay.
have the. I went through your records also. I went through our
Okay.
earlier conversations as well, and then. So we haven't taken the scan for you here yet, or have we? Because I don't see it here yet.
No, you
They haven't taken it. Okay. Right. Okay. We'll go to that a little later then. So I know my assistant. She's gone through your concerns. So I'm just going to go through them once quickly before we know that you're on the same page.
Okay, let me put my hair back.
Yeah, sure. Right. So you're concerned about the nose
I am.
and your prominent cheekbones,
Definitely.
broad chin, and also something about your occlusion, your bite. I think you're not having
I
perfect
wasn't
bite.
aware of that. Because I usually wear braces and I stopped wearing my retainers, so she told me about the bite.
Okay, but you're not concerned, so I'm not concerned either. See, I just want to know your main concerns first up, and then if we find some other incidental findings, we'll take a record of that also. Yeah, sure, you can leave it. Okay, you can bite. Okay, open, bite. Good. It's not too bad. It's not too bad. Your bite is good. It's fine. We're not going to look at your bite. I think we can let your bite remain the way it is.
Yeah, I think
It's good. It's good. It's no problems. Okay. Right. Yes. Right. And also, you have some concern about your eyebrow.
Yeah, I was like.
What exactly do you want to do?
It's more of my eyes. I think my eyes are always sleepy and looking majority of the times. I got a lot of rest last night, so it's probably not that sleepy looking. But I was thinking maybe if I could get like a
little
my
bit
eyes will go up, and it makes me look. I think when your eyes are up a little bit more, it makes you look younger. I'm a little bit older for my age.
Yeah, but we're going to do a lot of other procedures around, which is definitely going to make you look younger. I'll tell you why. I'll explain to you. I'm going to show you on the mirror, or this is good. On the mirror, maybe you can get an idea. Now see, I'll tell you what all. So the first thing is, this is going to go a little bit more softer. And this entire part, this much, and this part is going to go by like 3 to 5 millimeters, not a lot. And then this is going to come up. And we're going to probably augment it there, narrow it down, give you a slightly better nose, but I'm not going to take the racial features off. So you're not going to get a Caucasian nose, right? We're still going to maintain that because otherwise it will look a misfit. So we'll keep that nose the way it is, we just augment it. But let me just finish this. So when you augment this, your eyes are going to get better, especially this half. Because as you tighten this, you see the medial canthus it all gets stretched because it's just that one skin that's going over and under.
Okay.
So that will be a big benefit anyways. And when we're working on the sides and we're working on the tip, and when I'm augmenting that, this part of your face is going to get fuller, tighter. So what we're essentially doing, we're taking the fullness off here and we're tightening it here. So this part is going to get taken care of anyways. So the only thing that you might want to consider is this, because we're not going to roll. So don't worry about anything around the eyes. It's already going to get improved with the planned procedures. So this, it's not a big deal. You can take a few millimeters up if you want.
Yeah.
I can start there, so you're not going to have a visible scar. Okay, that's something we can do. A very simple procedure.
Okay.
Now with the chin, it's broad. B, your lower lip is little everted and pouty, and this is broad. Why I say broad? Because this should be lesser than the distance between your eyes. If not so much, at least a little bit more. So we're going to get this part forwards so that the profile, when you look, comes like this. It's narrower. But once that's there, this gets like a V, gets more angular. this whole thing gets angular, and the lip gets thinner. This fold gets better. This gets narrower. We're already going to take care of this part. So basically, it's going to be your middle third and lower third. Upper third, we're only going to get this a little bit raised.
Okay. So you were saying something on the when we're.
I'm not going to do anything to the lips, but your lips are going to get thinner.
Okay, because you did tell me the consultation, that probably
It will
needs
get
to be done, but I get what you're saying.
Yeah, so when we work on the chin, the lips are automatically going to get a little bit thinner and much more inverted, not
I
everted.
need my nose to be a little bit longer.
Yeah, sure. How long would you want? Okay.
A little bit longer,
Done. That's that's quite long, but I'll do that. 1 centimeter I can do.
Yeah, long enough to fit my face.
Sure.
You know best.
Yes, because see, this is already this much and this is short. So we need to augment. There are two ways we can increase the length of the nose. A, the place it starts, and E, the place it ends.
Okay.
So I'm going to work on both the ends. So now your nose is starting here, but just see if it starts there, it already looks longer. You know what I mean? So we're gonna alter the place where it starts and also extend the place where it ends.
Okay.
Therefore, you will get a longer nose.
Okay.
Eventually, the nose will look 1 centimeter longer at least, because I think that's the kind of length you would need, for the chin.
And then one more thing. So when you put this up a little bit more,
Uh-huh.
I don't want it to be too obvious that, I don't want like a crease.
You won't get anything. No, it's going to look
or,
natural.
Just as though yours is natural.
It's going to be
I just
looking
want it to be
natural. Are we going to have those bones fractured and taken in to have that natural look?
Okay.
It's not going to look worked
the nose
on.
is not going to look like.
No.
Okay.
No.
Okay.
No.
Okay. You know best though, so.
Yeah, but I still like to talk to you and we are all on the same page, because sometimes it can happen that I'm thinking I got what you want and then I don't get that, and then I do that and then you're not so happy. So just to so I don't want that. So
what
that's why.
Like I see you do on your videos, I see you do like a genioplasty to your patients.
Yeah.
I really like to see how that look when you do it on them. I'm not sure if it's gonna.
It's going to look awesome on you as well. It's going to look very good.
One last question. What's wrong with my cheeks though? People always tell me that you're not an ugly person, but there's an issue with your cheeks.
Okay, the thing is, it's no issue. It's just that the malar bones are too broad. So it gives you a little manly look.
Exactly. Exactly.
Yeah. So that we can just.
I look at my father. Yeah.
So we can soften that. Even the chin is broad and short. It's a little manly. When we get it more pointy and more proportional, it's going to get a little bit more feminine, so to say.
Okay, I get what you're saying.
All right, come over. So the next important question is, when are you planning to head back?
So the person I spoke to on WhatsApp, they told me that I needed like 10 days to stay here.
Yes.
So I booked my ticket for the 8th to go back home.
Okay, that's exactly 10 days. Because today is the 29th.
It was a little bit more than 10 days because I added I had to travel here and so I left from the 27th. I was traveling from the 27th.
Yeah, but today is already the 29th.
Yeah, because traveling.
No, but we need 10 days.
Hospital.
But we need 10 days here to be on the safer side. Now, let me put it like this. And 10 days after we do your surgery, we're not going to do your surgery today. We're going to do your surgery tomorrow because I still have to go through your scans. See, what I've told you is just a clinical idea. But now I need to know how many millimeters I really have to move. I have to check the nerves, the place where the teeth roots end, so many things to work on. Your septum, so that needs time. That needs planning. So if we schedule you on tomorrow, let's say, tomorrow is already the 30th. We don't have any 31st, so it means 10 days from then is May of 10th of May. So is it possible to postpone your tickets, let's say, to the 11th to 12th? In case needed.
I would say up until because I have to go back to work on the 10th. No, on the 11th. I have to go back to work on the 11th.
What kind of work are you doing?
I do customer service.
So it's like working behind a computer or sitting in front of a desk where you meet people?
Oh, working behind a computer.
That's fine.
Yeah.
You can do that. That's okay. You can do that from here also maybe, or you can do it from your location.
My computer, that's the sad part of it.
Okay.
I brought my computer.
So you want to get back on the 11th?
I want to get back on the 11th. I can leave here on the 10th.
Okay.
Yeah,
We're still going to be
definitely.
keeping it very tight. I'll tell you why. See, if you're a local patient, it's different. You can always come back for a review. But when you're traveling so far into a country like where you're coming from, where these kind of surgeries are not done normally, the doctors do not have much idea, and so they panic and they don't know to do exactly
If something goes
troubleshoot in case something goes wrong. And then it's really bad because it's a small thing that can be fixed with a simple dressing, for example, for a couple of days. When it's not done, can lead to a bigger infection or a bigger issue that causes problems.
Yeah.
That's why we say, like, even if you were in another Indian city where I have some other contacts and I can get them to just do what is needed to be done, and then it's like simple troubleshooting because we're doing multiple procedures. We're going to harvest your rib. So we're going to do the nose. It's an augmentative rhinoplasty plus a genioplasty, jaw sculpting, cheek contouring, buck of back fat. Yeah, it's a lot of things. And when you do more and more things, then you need extra time.
But today is the 30th, so it'll be like
Today's
9
29th.
days. I think nine.
Today's 29th. We'll operate, let's say, tomorrow. It will take a day for us to prepare you with everything. So in case we're going to try and schedule it tomorrow, but still, you leave on the 8th. So
No, I'll change my ticket to the
10th
the
at least? Okay.
To the 10th.
So you're going to leave our city on the 10th, which at least gives us 2 extra days. All right? Yes.
I'll have to call out from work on the 11th because it's going to take a little bit longer to.
Yeah, if
get
you can
home.
do that, it's better. See, because this is, I'll try and show you the kind of improvement that we're going to get on your face. It's going to be quite dramatic. It's going to be quite a lot of improvements, and it'll take a few months for your results to sink in, for you to start feeling normal and all of that. But that's why I'm saying the time thing. And see that?
Okay, yeah.
So we've done similar things for her. And to start off, you're not like as severe as she is. You can see where she's gone.
Yeah, her face got way smaller.
Way smaller. And look at the skin. Look at the folds that she had. That was really exaggerated. That she told me that people were telling if she's a boxer or something, and this is what she was telling me. And so that's the kind of improvement you're going to get. And this is, mind you, 1 month after it was done, when she sent me the pictures, and she stayed with us for 13 days.
13 days?
Yeah, she's from Australia, yeah. So that's why I say little longer is better for you.
Okay, I'll try to reach out to my...
If you can stay even 13, 14 days, better. Longer the better. We're not going to send you off quick.
Okay.
We like to hang around. And if, let's say you heal very well, see, this is not something I can predict correctly. Some patients heal dramatically, very rapidly, very quickly. I'm like, doc, I'm like really good. Well, you just hang around, do some sightseeing, all of that.
Yeah.
And if you still need some help, then we're there. Rather than go somewhere, and if there's a 1% chance, then the whole experience of yours gets sour.
Yeah, I don't want that.
Yeah, neither do we. I don't want that more than you actually.
I'm more concerned. I'm more concerned about getting back to work, but I'll just try to get to my boss and see if he can give me some more time.
That will be big help.
Yeah.
Try doing that straight up because you have all of today for that. In case we do the surgery for you tomorrow as planned, after that you won't be in a position to do that for a day or two.
Okay.
So it's better you do that today before we start off, so that even
if I have to stay, then I have to stay.
Exactly.
I'll work around it. I get.
But instead of doing this in the very last minute, like doing it on the 6th, do it now, because
I'll try to reach out to
it's better with the airlines also. It's better with your work also, because I know.
So
I'm saying out of a lot of experience, it's better you stay longer.
Okay.
Otherwise, I won't be so clear with you.
Okay. So you think the 11th or 12th
Is better. If you can do it 13th, even better. I'm saying even you can postpone it by even few days if you can.
Okay.
But don't do it before the 11th or the 12th. Let's say you get 14th, excellent. If you can get a couple of more days. Keep that in mind when you're talking to your boss or when you're getting the company to get the leaves off. And also when you speak to the airline guys.
Okay.
Because let's say they have a flight they give you the same price after a week, go for it. I mean, it's fine.
Okay. Yeah, I'll call him today and see what he can say, and then I'll
Yeah.
call the airline.
I've never been to your country, but I watch a lot of cricket.
Yeah, you know Chris Gale.
I know all of
Yeah,
them.
he's really good.
I know all
probably you know
of them.
Brian Lara.
Of course.
Before Chris Gale.
Yeah.
And we do well in track and field as well.
Yes.
Bowl, so.
Yeah, but I'm mostly just with cricket.
Okay. Oh, okay. Yeah.
Lovely grounds there. It's one of my things to come watch a cricket game in Jamaica. I don't know,
Yeah.
maybe
you've
sometime.
never been there?
No, I've never been there. I've been to the US
no.
several times, but never to Jamaica.
You should come to Jamaica.
Yeah, I know.
Oh yes, in regards. Oh, we'll get there when you tell me when we get there.
रिजो आए क्या? And so you can have normal diet for today. I know it's going to be like little crazy food here, but you can try what you think is safe because I don't want you to get some deli belly or some stuff like that.
You know, I haven't eaten from yesterday, and two reasons I haven't eaten, because I know that when you're going to do the surgery, you're not supposed to eat a certain amount of time. And then I wasn't sure what to eat as well.
So try to eat anything that you're comfortable with. We have a KFC, things like that, you know.
Oh, yes.
Rather than trying something new that might upset your stomach, because the food here is very spicy, and it's generally that spices that upsets your belly rather than the microorganisms that people think. It's not that unhygienic. It's just that it's the way they prepare food, and you just can't accept it immediately. So you got to go slow on that, and I don't want you to have an upset stomach like a day before surgery. So just be careful on that today. I know alcohol because we're going to start the surgery tomorrow.
Okay, I don't drink, but you know.
Yeah, no, just in case, because patients, this is a major surgery, you know. We call you the next day, and so I just.
So when is the last time am I supposed to eat?
Today dinner.
Today, like what time?
10 p.m. is good.
10 p.m. No, okay.
10 p.m. is fine.
Okay. Alright, so I'll just stay at the hotel
Sure.
tomorrow.
Are you comfortable at the hotel?
I didn't like it. I'm
Really?
not gonna lie to you. I have to be truthful. The room was okay, but
Where are you staying exactly?
it was not too far from here.
Do you know the name?
I don't remember. The person who I spoke to, they were the one who sent me the link to the. Here it is. Grand Hill or whatever.
Yeah, so what's the problem here now? Because we can ask them to give you a better room. You like the room or you didn't?
That's what I'm gonna do. I'm gonna just ask. The room was fine. It was just the bathroom. It was unclean.
Yeah.
So that's.
No, the bathroom is not clean, then it's not a good room.
It was not clean, but the room was okay. I couldn't even shower.
Really? That's bad.
It was bad.
Okay, so we will. You should have just gone up to the reception and told them this.
Tired.
Okay, cool.
I was so tired.
So we'll get that sorted out. He will do it for you today.
Okay.
Like you have 1 ghanta to lagega. It's going to take you an hour at least here. So we'll take your scans. We'll run your blood tests. You
That's
speak with
fine.
him. So then, did you get something to have in the morning?
I haven't, but I'm good. I'm good. I'll go get something afterwards.
Sure. So we'll finish all of this in an hour quickly.
Yeah.
All right. Photos, scan, blood test. सारा कुछ करना है इनका blood test. ठीक है ना? All right.
Okay.
So
that's it.
I call you Christine or Carry On or
Carry
Cheese
on.
or what?
You
Carry
can
On.
say cheese. Everyone calls me cheese.
Yeah,
They
that's
like
easy.
that
I'm not going to forget that.
They like that name. So everyone
Me too.
calls me cheese.
Me too.
Okay, so it's nice talking
So I'll see you around, Cheese.
Okay, I'll see you.
If time permits, I'll see you today once your scan's done. But if I get busy with the surgery, then I'll see you tomorrow.
That's fine. I understand you're busy. I really do.
No,
I
but
see so
seriously.
many people outside. I know you're busy. Okay.
Take care.
Take
Bye-bye.
care. Bye.